Thank you so much for joining us on today, July 21st, for another one of our 2026 Georgia Reentry Awareness Month events. My name is Walisha Wilson Menifee. I'm the founder of New Life Second Chance Outreach. And this is a very special event because it's with one of my dear friends, Roberta Toni Meyers, who is very passionate about the work that she does. And every year, this is our 10th annual reentry month where we have gotten a proclamation from the governor, and this entire month has been filled with virtual and in-person events to support justice impacted Georgians throughout the state, as well as family members and allies, and just to bring awareness to the events, to the things that impact those of us who are directly impacted by the system. Today's event is a discussion where we will be talking with Roberta Meyers of the Legal Action Center, and we're going to be having a conversation about the importance of access, equity, and opportunities when talking about justice, breaking barriers, and defending dignity. LAC's mission is to fight for the rights of people who use drugs, are in recovery, are living with HIV, AIDS, or mental health conditions, and people with arrest conviction records. Their work centers fighting discrimination, advocating for equitable health outcomes, and shrinking the reach and harm of the criminal legal system. Today, Toni is going to talk about the three priority areas: fighting discrimination, building health equities, restoring opportunities, and other projects that LAC has going on. But in the meantime, if you have not joined us for any of our other events, please join us and go to our website to the Our Work tab at www.nlscoinc.org and go to our events tab to check out our upcoming virtual events as well as the last week of events that will be happening in Columbus. This week, tomorrow, or the 23rd, which is Thursday, we will be having a virtual community introduction of Supply 360 to talk about their opportunities for the individuals who want to get a job in the trucking industry, as well as wanting to be dispatchers, warehousing, and going into business for themselves. That will be our lunch power hour from 12 to 1 Eastern on Zoom. And then later that evening at, I think it's 6 p.m., if I'm not mistaken, we will be having some job tips to prepare individuals on how to engage with employers, particularly if you have a criminal record, how to answer questions of when you've had long time in prison, how to explain that gap in prison, how to explain if you've never actually worked, how to explain that you've had a lot of arrests that were due to you being in active addiction. How do you explain and answer certain questions? So if you can join us for those virtual events, we'll make sure we drop the link in the chat, as well as you can go to our website to see any of those. So without further ado, we're going to go ahead and let Toni come in the room and give us her presentation. There you go, Toni.
Thank
Welcome. Thank you.
you. Thank you, Alicia. I'm so happy to be here this afternoon and to be with my people. I'm the Vice President of State Strategy and Reentry at Legal Action Center, kind of worked my way up in the organization. I came in almost 3 decades ago. I look like I started when I was about 2 years old, but came in to worked there while I was in college, and it was at a time, where there weren't a lot of organizations definitely during that time doing any work to fight for people who were pushed to the margins of society because of whatever issues they may have had, whether it's drug use, having contact with the criminal legal system, just any of that. And so for me to find an organization like Legal Action Center, it actually was life-changing. I had been in college for accounting and thought I didn't like people, only money, and soon learned that there were a host of social justice issues that impacted my family, and I wasn't aware of how I fit into the larger scheme of the work that they were doing in terms of fighting for the rights of folks. One of the things Walisha shared what our mission is, and we were founded back in the early 1970s. We actually spun off from the Vera Institute of Justice as a demonstration project. And so we've been operating for over 50 years. And for most of that time, we have been the only organization in the world, I said in the world, in the country that used a multi-pronged strategy to challenge the social justice issues of our time today. We use legal and policy strategies to combat discrimination and to advocate for equitable health outcomes because we really saw that a lot of the challenges that our folks were dealing with stemmed from issues that they were facing and dealing with in a community that were being neglected. And then people were then funneled into the criminal legal system. And so our biggest goal, again, we were at a time when the climb for what we're always hearing about the number of people that have arrest and conviction records. We were created at a time when that up climb was starting to happen, when there was this move for what I call the war on people, but the war on drugs was starting to get a foothold in the country. And then we had the 1980s boom of incarcerating any and everybody, mostly Black and brown folks that had any involvement with the drug challenges and the crisis and epidemic that we were dealing with in our country. So a big part of our work turned to shrinking the reach and the harm of the criminal legal system, and we still operate from that point today. Um, Let me just move to the next screen. And I simplified. This is probably going to be one of the simplest PowerPoints you've ever seen. Can y'all see the PowerPoint? Because I think I moved from it some kind of way. Can you still see the PowerPoint?
Yes, we see.
Oh, okay, cool. All right. So I'm sharing the website because you whenever you get time, you can go on our website and really take a look of what, the history of our work and what we're doing now. But we really have been fighting the punitive criminal legal system and challenging a lot of the drug policies that have led to over incarceration. And has also been the result of the failure to invest in the communities that we have, and especially our healthcare system. The results of these policies, as you know, have devastated lives, have devastated communities, and have perpetuated systemic inequities on a massive scale. And that has influenced a lot of the projects and initiatives that we have today. You know that 1 in 3 American adults have a conviction record. A disproportionate amount of those individuals are from low-income communities, and they're individuals of color. Um, as a result of that history and the impact of having a conviction record, many people have been locked out of being able to live and operate and be a part of society. And a lot of the work that New Life does in terms of connecting people to job opportunities, making sure that they have access to housing, make sure they have access to every support that they need. There were laws and policies put in place to prevent and to serve as a hindrance for our folks to actually participate in society. I'm not going to get into the details of how deliberate that was, and I think we know the story. Um, but we know that a lot of it was deliberate, strategic. It still plays out today. And our work at Legal Action Center has really been centered around fighting back and rolling back all of that, all of those efforts. And so the way that we work, we're a nonprofit law and policy organization. We're actually based in New York City. We have that's where we're incorporated in New York. We have our main offices there. We also have an office in Washington, D.C., because we do work on the federal level. And as of 2020, many of our staff are staffed across the country. I was actually the first telecommuter. I live in Georgia. I moved from New York to Georgia in 2009, and have been living here ever since. And it's because I work with folks all across the country. But to just give you just a quick overview, we do provide direct legal services. We have attorneys on staff that support people in New York State who face discrimination based on their arrest or conviction records, if they're discriminated because of their drug use history, if they purport to have a substance use disorder, if they're in recovery. And we also fight for the rights of individuals with HIV and AIDS. And wrapped into that work is really our effort to combat the stigma that's tied to having these particular issues. And so again, our legal services work is based in New York, but a lot of that work informs the policy work that we do in New York State and that we take into our work in around the country. And I'll talk about that in a second. We also do impact litigation. So we bring litigation to challenge systemic human and civil rights violations. We use litigation to expand the rights and protections of our people. And we do it also to affect broader change that can benefit many communities. And over the years, we've done litigation around drug testing, around housing discrimination, obviously around employment discrimination. We've challenged efforts to keep treatment programs out of particular communities. We've challenged individuals being discriminated against because they have HIV or AIDS. We've brought a lot of impact litigation over the last decades. One area I wanted to point out that we're looking for plaintiffs on it and are really monitoring more is access to nursing homes for people who were incarcerated. Sometimes we're finding that some nursing homes don't want to accept some of the folks that have someone that has an arrest or conviction background, and are denying them access to long-term care facilities. So if you hear anything about that as an issue, right now they're looking in New York, but I think if we can show how big of a problem this is for our people, especially since we have a lot of people coming out of the carceral system, having served decades and decades of time and need that support and care when they come back into the community, we know that it's a fight that we'll need to continue to undertake.
Now, wait. So can
Uh-huh.
you back up when you say that again? You say the nursing homes have been doing what now?
Denying access to people who like someone say so say for example we have someone who
Oh, if they have a criminal record.
right, they get
Oh, yes.
parole and they're aged and they
Yes.
need to go into a long-term care facility. There
Yes.
are homes that are nursing facilities that have been denying folks for different
Okay, well, I need to call you because of
yeah,
course we
because
have
of their
been searching.
record. Yeah, so yeah, that's what I just wanted to put that out there. We're looking at that and looking to potentially bring a case. And so, it always starts with collecting the stories and to see
Hmm.
what laws we could use to bring the cases. But I just wanted to point out that that is one area of the law that our attorneys are looking into bringing a case.
Okay, because
Um,
I have definitely have had that issue with trying to
mhm,
find housing for elders, and a lot of these folks have been incarcerated 40 and 50 years. All
yes.
their families gone. They don't have any loved ones to stay with. And I know for a fact in the last 3 to 4 months, I've probably called every um, nursing home in the state of Georgia, and every last one has said we can't take them because they have a criminal record. We can't take them
Ooh,
because they have a criminal record. We cannot take them because they have a criminal record. And they certainly won't take them if they're on the sex registry. And I think that's
wow,
awful,
wow,
that some
wow.
people are actually being denied parole, or basically because they don't have anywhere to go, they keep them in prison because that's better
Exactly.
housing to them. And I think that's wrong. So
Exactly.
I'll definitely make sure I update you with that.
Please, please. Another approach to our work, I mentioned the policy advocacy, and that's the shop that I sit in. And we work with policymakers and advocacy partners in Washington, D.C. Obviously, we lead a lot of the work in New York State, but we also work in other states. And so, a project I'll talk about in a little bit is where our national policy is housed, and we work alongside. All types of organizations, whether they're public policy think tanks, whether they're community-based on-the-ground organizers, whether they're legal advocacy organizations. We kind of work across the spectrum, one, to bring folks together, but also to work with those respective groups to support their strategies in any ways that we can and serve as a bridge between the different groups as well as a convener. And so part of that work is, advancing the laws and regulations that it eliminate discriminatory policies. We really work to protect access to health care, and obviously to promote opportunity. We talked about, we know that there's so many ways that our folks are banned and excluded from fully participating in society. So we're always looking to challenge that. But a lot of our other advocacy efforts are centered around expanding alternatives to incarceration and diversion to treatment and reentry. We want to keep as many people out of the system as possible. We obviously want to reduce collateral consequences of arrest and conviction records. We're always fighting to end the stigma and prejudice that exists against individuals who use substances or are in recovery. We're consistently trying to dismantle the systemic racism that plagues both the health and the criminal legal system. And I'll talk about that with the project that I also lead. And then we fight to increase access to the full spectrum of services that are needed for people who use drugs. And that is really centered around our efforts to protect harm reduction, but also expand access to harm reduction services. And we've been doing that for decades. And continue the fight where, this administration has been really rolling back and attacking harm reduction services and programs. Our other work that is central and key to what we're doing is protecting people's privacy. Because we know that, for people who have HIV and even people who have a substance use history, and even our folks who have records, by their privacy being challenged in different ways, they are in effect dealing with the stigma of having that background. So a lot of our work is really about how do we kind of clamp down and make sure people's information is protected, while we do the work of making sure there are strong protections against discrimination. But our feeling is the more that we can keep out of the public realm and out of public space, the more protection we can offer our folks. And then lastly, we work to increase community-based prevention and recovery services and supports, and really fight to make sure all of these systems operate with culturally competent care, and offer different options for the folks that have needs. The other way that we work is through coalitions, which is how I come to meet Walisha. Is we work with coalitions around the country who are working on the same issues that we care about, but we also lead a couple of coalitions. So one of the coalitions that we lead that is a national conglomerate of organizations that work on health issues is the Coalition for Whole Health. Which is a group of over 100 national and state mental health and substance use disorder organizations. And that coalition is the group that's fighting on Capitol Hill for our folks. They are the ones on the Hill fighting to make sure there's money available to increase access to treatment and other services. They're the ones, putting forth the policy recommendations and working with the federal administration, whoever is in office, to ensure our folks are considered, and that they're not, boxed out of getting any opportunity that they need. We also lead a coalition in New York. I mentioned that's where we're based, so we get to do a lot of the on the ground and lead work, in coalition work. We lead a coalition called the Alternatives to Incarceration and Reentry Coalition. And it's a coalition that was formed and has been modeled across the country in other jurisdictions, where you have a group of organizations, whether they're direct service providers or policy think tanks or case management organizations. They have all come together to work to build out a comprehensive system throughout New York City and New York State to support our folks getting the care that they need without entering the criminal legal system. It's one of the most amazing collaborations that I've had the fortune of witnessing, of these groups coming together. They pool their money to get lobbyists that lobby for our folks in the way that the other side often pay for lobbyists to do on at the Capitol. But they've been in operation for I think probably 3 decades. I can't add two decades. I think they came together. We founded it in 1984. But they fought to get budget lines put in place to make sure all of the organizations that are providing alternative to incarceration services get their fair access to the money, and not just any one single organization. They work together to support each other. We also lead a coalition that we co-founded, that brings together a lot of the legal advocacy groups that are operating in the city and across the state. And they all work together to promote policies to help people overcome challenges as a result of a criminal record. They're the ones working together to write legislation, but then they also work together to build out legal services and legal advocate strategies that's kind of tied to the fight, which I thought was a really unique way to lead efforts across the state. And then finally, we provide training and technical assistance. Where we work with folks in communities, we work with elected officials who contact us to get our expertise, where we share model policies, best practices, and also a lot of landscape analysis. So because we're national, we monitor a lot of what goes on across the country and have a good eye about what's happening on a lot of our issues around employment barriers, housing barriers, criminal records, voting, access to public benefits. And so we have a number of projects and campaigns that are underway. I'm not going to talk about all of them. I'm going to talk to you about the two that I'm most intimately involved in. But just for your awareness, we have a number of initiatives that we're leading. One of them is Clean Slate in New York, and we know Clean Slate is a policy that's being advocated for in a number of states. But we're included in that, and we led the effort for Clean Slate with a number of our partners in New York to get it. And now we're deep in the throes of implementation and making sure that the law works for who it's supposed to work for, and for whatever additional work needs to be done to expand its reach and expand eligibility. We're involved in that. I talked to you about the Coalition for Whole Health. We have Faces of Medicaid. We have been deeply entrenched in the fight to save Medicaid. It's been a hard battle, but we're still collecting stories from folks and using that as part of our advocacy. We're currently working with states and with agencies implicated in a lot of the changes that are happening around Medicaid. We're working with states to mitigate as best we can the harm that's coming from H.R.1. So there's a big project tied to that. I'm about to talk to you about No Health Equals No Justice. I'm going to talk to you about National Hire Network. Those are two projects that I'm a leader on. And then we have the Medicare Addiction Parity Project. I talked about the ATI Coalition. We also have a project watching the opioid settlement work in New York, and that work is influencing our work in other states as well. And then we lead what's called Parity for All. I encourage you to go to our website, and you can get a lot more information about those different projects, initiatives, and campaigns. It'll be interesting to see, um, interesting to take a look at the work that we're doing there. So I'm gonna talk to you about. I can't see anything, so I don't know if anybody had any question. While Alicia, I can't
Yeah,
see the screen.
there was a question, but it was unrelated to what we're talking about.
Okay,
But we will have Q&A in probably about 15 to 20 minutes. After her
okay,
presentation, we'll open up for Q&A. But if anybody has any questions, feel free to drop them in the chat. If you raise your hand, I'll drop it in there in the chat, letting you know I recognize you. But we're going to wait till your presentation to do any questions.
excellent, excellent. Thank you. Okay, so the No Health Equals No Justice initiative, which is a baby of mine, and I love it. It's the main work that I get to do now. And I mentioned that a lot of our national policy work kind of flows through this particular initiative because we use this initiative as a multi-state advocacy and education strategy to advance decarceration efforts by ensuring people are no longer criminalized and incarcerated for conditions related to their health. Um, Again, I talked about some of the issues about privacy. So we want to protect people's health information. We are fighting for people's right to access health care, and that talks a little bit about the litigation work that I told you we're working on. That is also part of our advocacy work. And we really fight to make sure people are not excluded from full participation in society. So, because of arrest or a conviction record. So, this campaign actually embodies all of the work that Legal Action Center has been doing for the decades of its existence. But what we wanted to make sure was a central and key element of our advocacy was to advance community-driven solutions that address systemic racism. And that promote health of the mind and body. Now, like I said, we're a law firm, so for a long time, I have to say we didn't really look at our work in that way. It was like laws, policy, you know, organizing, bringing people to the front, to confront these systems, but really thinking and being deep about not just changing these laws, but the end goal has to be that the people we are talking about, the ultimate goal is that they get everything they need to be healthy in their minds and in their bodies. A lot of times, you see a lot of policy initiatives that focus on one or the other, or neither, in a sense. And if you when you start peeling back the layers, but for our initiative, which started out as a campaign in 2018, but we've now decided, no, this is to stay, and we want to make it central and key to the work that we're doing. And so the way that we've built out this initiative is it is driven through our partnership with allied organizations. Primarily in southern states, but we have folks in other states like Illinois and New Jersey, and Pennsylvania. We've had some folks out of Ohio at one point, but really partnering with a base of leaders that are interested in coming together, talking about what the challenges are in their respective jurisdictions, and then spending a lot of time strategizing on ways that they can move the needle in their communities, and we can help support that as a group. We use it as a space. We have what we call a partners table where we bring folks together to talk about the issues. We bring experts around particular issues like bringing in NAMI or bringing in
Mm-hmm.
somebody from FICPFM, the formerly incarcerated and convicted people's movement, all of us are none, whatever. We bring people to the table to share about the work that they're doing and how they can help, and just also making sure people know about different ways they can plug in on a national level and have support on the work that they're doing in their jurisdictions. And so we use that space as a part of our effort because it's a symbiotic relationship. We share our expertise, we share our resources, we share what we know, and then we also look to get back information. A lot of the people who commit, some of our formerly incarcerated people who are leading organizations in their respective communities, they often share their networks with us as we're trying to collect information to make sure that our policy advocacy is informed by the people who are affected by the policy. Because we're a think tank. We have a think tank arm, so to speak, even though we provide direct services. We try to hear from all across to get diverse perspectives. And it's just my baby. So this picture is a picture of our team. Victoria is on the far, I don't know which way y'all looking at, far left, and then Gabrielle Della Garaneri, she's another VP, actually like my Siamese twin in this work, but she leads a lot of our federal work on the issues that are at the intersection of health and justice. Victoria, who I said is on the far left, she's the Deputy Director of State Strategy, and she and I work very closely together. And then Jessica provides us a lot of our support. And then Deborah Reed, who's standing next to me, she's an attorney in our DC office who has an extensive background in reproductive rights and a whole host of issues around privacy and confidentiality. But she's our resident guru on a lot of things. So we lean on her for a lot. But that's our little core team. Our organization is much bigger. I think we have, I don't even know. I mean, I say bigger, we're not big at all. We got like maybe 40 staff. It's not that big. But it's an initiative that I hope you will check out. Again, we get to do work here in Georgia that I get to do because of this project, because of the expansiveness in terms of what we're trying to do. And I'm able to support the work of folks here in Georgia and love that I get to do that and to work in coalition and in partnership. If you are in an organization, leading an organization, and want to become a part of it, you can reach out to Victoria or to me, and we can plug you in. We love having people join these conversations. For example, we've been bringing together doctors across the country that provide harm reduction services or who have within their practices supported people coming out of the carceral system to get them to start talking to each other and it's been amazing. So we've been pulling people that I know here in Georgia into national conversations. And so I invite you to become a partner, join us at any time, and we'll be happy to invite you in. The other project, which is much older, so we started the No Health Equals No Justice initiative in 2018. The National H.I.R.E Network, we started back in 2003. And it was at a time when there was no real concern about the barriers and challenges that people with conviction records, and at the time, definitely arrest records, were dealing with that was keeping them out of job opportunities, good job opportunities, career ladders. And so we started this project, National H.I.R.E Network. I became the director of the project in 2004. Was it 2000? No, 2007. I don't know, 2007 maybe. But the focus, the H.I.R.E stands for Helping Individuals with Arrest and Conviction Records Re-enter through Employment. We made employment the primary focus because through our direct legal services, mostly people would call us and say, I need a job. I can't get a job. I've been denied a job. and you don't have any income, it's hard to even get any sound footing. So we decided, although we knew that yeah, our folks were dealing with a whole host of challenges and barriers, we decided to focus on raising awareness about employment. And so I set about that job back then. Again, there was nobody really talking about it. I met with workforce providers all across the country. I was working with directly impacted folks who would explain to me some of the challenges that they were running into, whether it was getting direct access to particular types of jobs or getting access to occupational licensing to get specific jobs, whatever it was. So I spent probably 2 decades doing training and education, doing advocacy, writing reports, working on every level, local in communities in states all around the country, and on the federal level with the various federal administrations, all the way leading up to President Obama, working to highlight and bring to light what the challenges are, but also what the solutions are that will eliminate and alleviate the barriers that our folks were consistently dealing with. And it was great, when we did that, we built a national network of over almost 10,000 people from all across the country and in the islands, the islands of connected to the U.S. and Washington, D.C. We had directly impacted folks, like I said, we had researchers, practitioners, you name it, anybody who cared about eliminating employment barriers became a part of that network. We were able to influence the kind of research that we needed to support our efforts to advocate for law changes. And I'm really proud. My friends like to jokingly say, I'm the grandma in the movement. I beg to differ, even though I am a grandma. But it's been wonderful to see the synergy that has grown from a lot of that early work. And we started with really looking at what is it that people coming out need in terms of training, job training, licensing, and all of those things. And then we got into the business of, okay, we can work on getting our folks the resources and access to the supports and things that they need to make themselves competitive in the job market. But the real issue are the employers. And so in 20 maybe 2013 and beyond, I started doing a lot more work with employers and doing employer education work. And a lot has grown from that. And our advocacy was focused on getting at employers. So we did a lot of work with the Equal Employment Opportunity Commission back in the day when we pushed them to have the hearings that led to the update of the guidance that was in existence at that time from back in the 80s. We got that updated. So a lot of work went into that. And so I'm just thrilled to share some of this history with you. I'm thrilled to share what we're doing today and hope that you would feel compelled to allow us to work alongside you where we can. Like I showed you, we're a small little shop trying to do our part. But that's what we're going to keep on doing. And I really thank you for your time, and I'm willing to answer any questions that you may have. And I'm done.
Well, thank you so very much for that. I've been dropping some information down in the chat as you spoke about it on those three areas. And you all, if you're feverishly trying to figure out how to save your chat, if you're on your phone, you can simply go to the three dots and hit save chat, or on your computer. I don't think you can do it on a cell phone, but no worries. We actually have a probably a shorter little event. So I'll make it a point to go ahead and email all of this stuff to you within the next hour. Once I can get it uploaded on YouTube. And that way you'll have it plus the resources. I did drop a recommended read that I found on LAC's page, which was the article on substance use based discrimination in healthcare, a conversation with LAC staff on drug user health rights. I wanted to find out, I know you had spoke about privacy.
Mm-hmm.
Um, what are some of the challenges that you're seeing when you come to privacy? I thought there was this thing called HIPAA. Are you saying that they're doing things
Yeah,
differently as it relates to people who are in substance use or got criminal records, or people just not there is such a thing as HIPAA, but when it comes to justice impacted people or people who are have HIV and AIDS or who are in recovery, they're treating them different and sharing
right.
their
So there,
information?
yeah, there's different protections that have been promulgated through law, and most states have some sort of law on the books to protect um, um, well, we know the federal law for health records, right? But that's an overarching. There are also separate protections tied to the release of information for HIV information. So if you were to get more deeper in that, health practitioners have to have not just typically one health release form that people have to sign. There's also a separate one for HIV information that has to be done. I don't want to get deep into that because I don't know all the details of that. However, that information is on our site. But there are legal protections that are stacked on the use of health and accessibility of health records, but there are also additional laws and protections tied to substance use records and substance use information treatment information when some the authorizations that have to be signed separate and apart from like a general release or protection information related to medical records. And so a lot of people don't know that. A lot of people don't know who is covered under the protections of the who's covered under the privacy laws in terms of who's not allowed to share information, and also if they are given the right to share, how they share the information and who they share it with is often dictated in the law. So there's a lot of ways that information. I'm gonna give you one example too, how this can come up and where we've brought cases in the past. Say someone gets arrested and they tell, as they're getting arrested, they tell the officer who's arresting them that they're HIV positive. That officer then yells out and tells all over the place, because I think we had a case like that. Starts yelling, this person got HIV, or we've seen some of the most crazy things happen. Um, Criminal record information doesn't really have protections like that unless it's tied to a sealing or expungement law typically.
Mm-hmm.
But when we talk about privacy in our organization, we talk about it from a broad frame of whatever the laws are that promulgate how information is supposed to be maintained, where it can go, who it can go to, and when. If there are any restrictions in law that imply, that set those standards in place and they get violated, these are things we often may get involved in. But I can tell you across all of the constituencies that we fight for, the laws are different and the rules are different and how it all comes out. So we do a lot of training around HIPAA and how substance use and treatment records are to be treated within that whole frame. We do training around how criminal records are supposed to be maintained or distributed. It's all different, but it's an area that is important because stigma is such a pervasive issue for our folks. We had to keep privacy and the use of information and its distribution as part of our repertoire of issues that we monitor and fight and deal with, because there aren't a lot of organizations that even work on that issue. We're uniquely one of them, and I don't think that there are many others.
Okay. Okay. Well, I have some more questions, but I'm gonna open it up for
Mhm.
anybody who's attended that has a question. Feel free to raise your hand or just take yourself off mute if you have a question that's relating to the topic. Okay. Well, I'll go on with mine. Maybe you just give you time to think about it.
Mhm.
Um, I want to ask um, with one of my clients,
Hmm.
I want to find out what your take on it from probably with LAC. He's been released maybe about 2 months ago. I
Hmm.
think he's a person with diabetes and several other issues. He's in rural West Georgia, um, up near Rome,
Hmm.
and got out. And, of course, the prisons, which makes sense, should release you with either a prescription for your medication. To me, they should be releasing you with 30 days of your actual
Yes.
pills walking out. So you have your medication, but they don't. But at the least they could do is give you a prescription so you can have it filled.
Hmm.
But he had a prescription and went to go get it filled, wanted to go see the doctor. And I said, well, your first thing you need to do is get established at a doctor so that doctor can, get your medication started. Explained he had diabetes. So he ended up calling a doctor's office and said that I need to get a doctor's appointment. I just got out of prison. So I kind of, I got to get my doctor and get established so I can get my medication on a regular. And he was told at the doctor's office that we only see prisoners during certain times of the year. The next time won't be into June. Now, mind you, he just got out in March or April.
So he is not.
So he's supposed to, A, work or wait. And this is a small town. So this might be only one or two doctors there. He's supposed, what are you expecting him to do? To wait until June, 3 to 4 months until he gets the medication. But that wasn't really the part for me, because we were going to pay for the medication for him. What kind of bothered me and really upset me, where I immediately called her, I had a problem with that because I called her and said, so what do you mean? She says, well, there's just a certain amount of time of the year that we see them. We usually see them in June and we see them in October.
Who
I
is
said, what do you
them?
mean you see them? She says, we see prisoners. And I said, this man is not in prison. For one, there are people in prison, but this man is not in prison. She said, either way it go, we only see folks that have been to prison or in prison in June and October. And I wondered if this has come from people in the waiting area feeling uncomfortable. And before I could even get that out of my mouth, she said it. She said, folks in the waiting room have a problem sitting in rooms with other people who've been to prison. And my question immediately was, how the hell they know somebody's been to prison?
Hmm.
Because I go to the doctors, I go to the restaurant, whether I'm at the bus station, wherever I'm at. That's not a question you ask people. If I'm standing in the line at the grocery store trying to get my collard greens and you getting your chips, am I supposed to say, you got a record? I'm not understanding that. She said, well, no. And I said, well, I would assume that's a HIPAA violation had you said or you mentioned it. But I have a bigger concern because my issue is the area that you're in is probably less than 3% Black, which means
Hmm.
Black people are probably more likely impacted by the criminal legal system, meaning in the months of June and October, you have
That is
probably have 100% of
insane.
Black people in this patient room. And she said, well, it just happens to turn out like that. I said, you know what that sounds like, ma'am? And just the look of it, it looks like colored waiting rooms or colored doctor's offices. And so I
Hmm.
want to just kind of find out from your position or lack, is that something that would be something that LAC would advocate for, maybe look into? Because to me, I would assume that nobody else would know anything about that if somebody had been talking about people being in prison, being in there in the space. But
This is
also,
the
is
work
that
that I
legal
want to
to make
do.
somebody wait
This
so
is work that
long?
I want to do. This is work that I want to do here in Georgia because I think it's much more pervasive than you may even realize, just from the one call. And then how easy she spoke about it like it was nothing because they
Yeah.
probably been doing this for the long time. And
So
it
is
could
that legal to separate, like to give certain months of the time of the year to only people? Oh, I'm sorry, Toni, you can't come in June because we reserve that for people with criminal records. Like you're
that
you, to know that you can't get an appointment in June because they only see an exclusive
So
population of
here's
people.
the thing. So here's the thing. One of the big ways that we had gotten a lot of wins over the years in the employment arena has been around race-based discrimination because of disproportional impact, right?
Hmm.
Um, because of some of the stuff going on with the courts, not many cases are being brought on that theory anymore. However, our civil rights protections still exist and race-based discrimination is still illegal. Um, there's a lot of ways that this could be, I think, could play out in the way that they're dealing with it. I personally, it's an issue that I would love to do more work on. I'm actually fundraising to do more work in particular counties here. But the other thing is, I don't know if it's more. So she said that, but I wonder
She initially was
also,
going to give him an appointment for 2 weeks.
right?
And
I
as he
also,
was talking, he said, yeah, because I hadn't had my medicine since I got out of prison. And she said, oh, wait, then you can't come in two
well,
weeks. You have to wait
she
to June.
just straight up like, and that's insane. They need to be fought on it. I can't say that it's illegal because my conversations with folks who aren't in the legal space, something can be wrong, um, it can be very wrong. But if it's not defined in law as illegal, then it isn't illegal. It's just bad behavior. And so that what lawyers get paid to do a lot of times is to piece together a case to fit in the scheme of the legal design that we have in our law structure to see if there are particular violations that they can pinpoint that are tied to. So because people with arrest and conviction records don't really have any protections, especially in the state of Georgia, there ain't no laws against mistreating somebody with a record or excluding and discriminating against them simply because of their record. When you tie it to race, if what they're doing based on that policy, only Black people are affected by it, the Black people who live in that town, um, then there can be likely a case that can be brought against them for what they're doing. But there needs to be a real look at what it is that, because I'm not saying that it's that it's never that cut and dry a lot of times
Yeah.
in that respect. But that's the kind of work that I do think we need to have done. I think our healthcare issues and the folks that are dealing with and why they aren't getting the care and the things that they need in community and end up in the criminal legal system all repeatedly is because of stuff like this. It's because of stuff like this. They either end up going back or they end up dead. And we can't allow for that anymore. And I really believe the health community have been just allowed to run ramshot and do what they want to do and decide who's deserving of care, like we just saw in this instance. And it's not okay. I do think it's something that's challengeable. I don't know in court, but there's other ways to fight. Like there's definitely other ways to fight. And so I want to talk to you more about that because the story you just shared is exactly why I want to do some of the work that I want to do with getting to health practitioners across the state, especially in some of these rural areas who think that they can exclude our folks just because, and we can't allow for that.
Yeah. Well, thank you. This has been amazing. Does anybody have any questions before we end? Okay. Well, we
Mm,
appreciate you and thank you so much. Toni,
thank-
how would one be able to get in touch with you? Is that
I'm
just by
so sorry.
email or we
Yeah.
did drop the email. I mean,
Okay. So
I
yeah,
dropped the
definitely.
website, but do you want me to drop your email? Because I don't want you to
Yeah,
be bombarded
please.
with emails.
Please
Okay.
do. That's okay. I'm bombarded anyway. That's I have given up trying to keep that under control because I'm
Okay.
lost. It's fine. I just tell people be patient with me. Don't hold it against me on how long it might take me to get back to you. And if I take too long, shoot me a note again. To
Now the
put
last
the
thing,
request back up at the top.
okay. Now the last thing I know is I know y'all do a lot of advocacy. So do y'all do any work with I know you do a lot on addiction and mental health. Do y'all do any work together with places like maybe 12-step programs or NAMI,
Yes.
like come out to speak to stuff like that with NAMI,
Yeah.
12-step programs and stuff
Yeah,
like
I've
that?
been in, well, I'm not with the particular program, but I do work with NAMI and I have been partnered with them on some projects. And I know we work in coalition with them on federal advocacy. But I do some stuff here in Georgia. I do work with the Carter Center, with a number of health advocates because I want to
Right.
see more of our criminal justice related work seeped into the health space because a
Okay.
lot of those organizations were working without thinking about our folks who are impacted by the criminal legal system,
Hmm.
even though they fighting for the same people, but they won't
Yeah.
never mention, or deal with the impact of the legal system and the connection of the legal and the health system.
Yeah.
So yeah, I'm engaged with health advocate groups here in Georgia. I want to bring more of our justice focused folks into that space and vice versa. So that's kind of what No Health Equals No Justice, what I've been doing over the last few years with
Okay.
trying to build bridges.
What about the Medicare America? There have been rumors floating around because I'm not really sure, so I didn't want to quote it. But supposedly, as of July, the new administration cut out is well Medicare or either Medicaid therapy for children who are having behavioral issues. Is
Mm.
that something one of the cuts that you heard about? I know that they
I
said that
don't know the
people they were going to
details,
start cutting
but
out rehabilitation.
I have colleagues on staff that know all the details about what's going
Okay.
on. I don't follow it closely.
Yeah.
If they call me in to find the folks who need the information, I do that. But I'm sure we have that information. I can
Okay.
ask. If you
Yes,
have
because
any questions, follow-up questions,
I
shoot me
sure
an
will.
email, and if
Okay.
I'm sure I might not know the answer, but I'll know who will know.
Okay, because we get a lot of questions from folks who want to also go into rehab or
Mm-hmm.
attend, things like that, but their insurance doesn't cover it, or they're told that their insurance doesn't cover it. So we're always wondering why is it that
Please.
why our insurance is not covering recovery or treatment centers and stuff like that? Is that
There's a
just something?
whole, yeah, there's a whole coalition in Georgia that looks at parity, and parity has to do with people who have mental health and substance use challenges getting equal coverage access as anybody else with other medical conditions. And so this group has been working, fought to strengthen Georgia's parity law, um, fought to get the insurance agency to start taking action against insurance companies that violate that law. And that work is still ongoing. And so there's a group that works on that. And there are people in Georgia that bring cases and fight. So
I
yeah,
cannot hear
just,
anything.
let me know. And there's a place to file a complaint with the state when that happens.
Okay, okay. Jennifer, did you have a question? We hear you. Do you have a question? I
I
don't think
guess
she
she
does.
might have been by accident.
Okay, I have you on speakerphone. I had to call you on cell phone, so I see that you have a question. Do you have a question for Toni? Okay.
Just getting in. But I heard you say a lot about HIPAA and all that stuff. I want to know what state this was going on because we have to. I'm a therapist and mental health therapist, and I'm a doctor, so we have to stick strong on HIPAA violations. We can't scream out that someone is HIV positive or any of their medical records. Are you saying this happening in the jails, which I know that's possible, or in a center? Can you tell me where was
She
that
said
happening?
she said someone was being arrested and the police officer said
Yeah,
something to
I'm
publicly loud.
Oh, oh,
it happens
wow.
all over the place. I was just giving one example. No, I
Yeah.
mean, it happens. You'll be just because people been trained on HIPAA don't mean that they don't violate it. Like we've had to go after health centers.
Okay.
We went after the insurance company. We sued an insurance company because they sent out notices, mailers
Yes,
that
I have a
had
question
people's
again.
HIV information visible through the little film part where the address is. You could see something about people's HIV status in the mailer. Like all kinds of things people do. So of course, practitioners have to be trained, but there are folks that work in different settings that don't realize that they're implicated by these same laws that a health practitioner is. And I just gave one example where we had to go up against a police department because
Thank you.
a police officer divulged someone's HIV status like publicly.
So
So
I'm
it
going to play
happens.
devil's advocate for right now. So as a playing devil's advocate, where do you cross the line from being a police officer who felt like other people might need to know that this person has HIV in case that person tries to bite them when they try to arrest them? Where's that line go? Where
There,
who needs to know what? If I'm arresting you and you say I got HIV, or I know this from I've arrested you before and you had HIV, where's that limit stops where I am not trying to be messy or tell their health privacy. I'm trying to let my colleague know because this person tends to be a biter, this person tends to be a spitter.
yeah.
How does that work? I mean,
I can't answer that because
I can. Go ahead.
could be litigated in court depending on how it was
uh
divulged and when and why. Like
and maybe the reasoning behind it, the way you
all of
said it.
that affects what the
Okay.
outcome would be. It's not that cut and dry. It's not.
Oh,
But go ahead,
Mhm.
Jennifer.
Well, first of all, police officers already trained and they already know when they have mental health issues, they have to wear that shield. It's a shield that they put over they. We had to do it when
Mhm,
we was working in the hospital. It's a shield and it's a type of gloves and armor they have to wear. If
mhm,
they go in the system while they sitting in the car and type everything in, and it might show, I ain't gonna say it's gonna show they got HIV, but it may show
mhm,
something to that effect. Right
mhm.
then, they should open their trunk and grab that shield and be and protect themselves and do what they have to do and move on to the next level, not screaming out saying
Right,
John got HIV and all this
right.
stuff right
Yeah.
here. You should be the only one got your hands on John, putting the cuffs on him and putting him in the car, and then y'all work that out later on. So
okay.
they train, but they don't want to use their training, and that's why I was saying in my meeting how they just beat up people with schizophrenic
Mhm,
issues and bipolar issues. I worked in the mental health 8 years, worked in the prison system 15, and I had a patient come into the mental health and he was schizophrenic. He knew me, and I went up front to try to help him get on the unit. And police department, I ain't gonna say the police department name, just started beating him and putting their leg on his neck. He couldn't breathe, and I had to
mhm,
get six
mhm.
doctors to pull the police officer off of him. So
Wow.
it's just this stuff got to stop. I'm for the cause as well, and like my thing working along with the courts, I've saved a lot of men from going to prison, 25-year sentences and stuff like this. I just couldn't become a lawyer because I didn't like the Georgia system, so I just stay in psychology and work along with the court system when I can, and evaluate for mental health and substance use and anger management. But you can go
Wow.
ahead. I just wanted to throw that in there.
Mhm. Oh yeah, oh yeah. They're trained on universal precaution. You can't just work with one person one way and work with another. There's a lot,
Hmm.
but that's the point I wanted to make. There's a lot in that. But that, again, just because people got the training don't mean they ain't gonna violate the law. So,
Right, right. Absolutely. I agree with you.
Mm-hmm,
Absolutely.
mm-hmm.
And we're gonna
And
make sure we
Marlisha, I'm
send you all this.
sorry. I gotta jump.
Oh yeah, we gotta jump. I was just letting
I'm supposed
everybody
to
know
get
that
to
was it,
another
and we're gonna be
meeting.
making sure we email you, and a lot of this stuff will be in the description of the video. Thank you so very
Awesome.
much, Toni. This has
Thank
been
you.
very informative, and thank you
Thank
all
you.
for joining us. And we
Thank
hope to see you
you.
at some of our other upcoming virtual events or in person. Y'all have a blessed day and stay out of the heat because it is definitely disrespectful out there.
Thank you.
All right.
God
Thanks,
bless y'all. Thank
everyone.
you. All
God
right.
bless you
Bye-bye.
too.
Uh-huh.
Bye-bye.
Bye-bye. Oh, this was great.